Greetings, my IDD subscribers. Today we talk about disc anatomy. So between each bone vertebra is a disc. This disc allows for wonderful movement, bending forwards, etc. So if we had to cut the disc in half and look at it under a microscope, it would look something like that. There's a gelatinous nucleus pulposus in the middle with 15 to 25 annular rings that holds this disc, this nucleus, in its position. Very strong rings. Between the disc and the vertebra is a nutrient interface. So, very thin layer. So the blood supply to the disc is via blood vessels that go up and down to the nutrient interface. There, a little bit of blood from the side. But when it gets to the nutrient interface, movement into the disc is via osmosis. Water out, waste out, nutrients in, water in, through that interface. The nerve supply to the disc is from the spinal nerve, spinal cord, spinal nerve, and a little nerve backtracks back to the disc. And that disc, found by Luschke in 1850, is around the edge of the disc. And it has nutrient supply 1/3 way into the disc. So this is a closed hydraulic system with its own nerve and nutrient supply. So how do things go wrong with such a system? Well, bad luck, your genetics, your hereditary. Some families just seem to have this, some individuals seem to have a problem with their discs. The second would be the mechanism of nutrients. For some reason, the osmotic function doesn't work, or the blood supply through the end plate, or something like that fails. The third is trauma or mechanics, heavy lifting, an accident, sports injury, twisting too much, lifting a boat, etc. And maybe the most common would be long periods of repetitive pressure on the front where there's no osmosis, and putting that nucleus under major pressure, maybe pushing it back. The next talk will be about the pain mechanism. Very interesting talk, the next one. Thanks for listening.